really is. Madam Secretary, thank you for joining us.
Glad to be here.
The Senate gave themselves a December deadline to try to address healthcare costs, but open enrollment obviously is already underway now. Is it already too late to address this issue for people next year?
Well, it's very tricky. People are going to have to at least shop online now. I think they may hold off to the last minute to sign up in hopes that something might happen and that their prices could come down. It's tough for companies to reprice plans, but they had to imagine that the subsidies wouldn't be extended, so that's how the plans are priced. Ideally, they have in their back pocket a second price that could go down if Congress does indeed act as people are desperate for them to do.
Or could these companies simply keep the prices high and, hold on to the difference there?
They could, but it would mean that they have far fewer customers. I mean, this is not in the company's interest. This isn't money that goes to the company. It goes to individuals who are buying their own coverage for themselves and their families who don't have affordable coverage in their workplace. So fewer people would choose to be covered next year. The company doesn't keep any of the money. They are pricing this based on a smaller, sicker market. And if that turns out not to be the case, the prices could change.
Something like 92% of enrollees in the ACA marketplace receive these enhanced premium subsidies. Is that a sign that this system doesn't actually work the way it's intended if that many people need that much extra help, essentially?
Actually, every single health plan in the United States is subsidized by the federal government, some more than others. And the Affordable Care Act plans are the least subsidized at this point. Medicaid is almost fully subsidized. Medicare is heavily subsidized. Every employer plan, everybody who works for a major company or a smaller company that gets employment through their business has a subsidy. They don't see it. The employers write it off tax-free. They get a benefit from that. They get a big pool. So this is not unusual. These are folks who are buying insurance out of their own pocket for themselves and their families. And the fact that they need some additional help is totally in sync with every single other plan in the entire marketplace.
Madam Secretary, I feel like if we were talking about any other industry in the country and you said basically every player in the marketplace, every competitor, if you will, had some kind of government subsidy, you would say that is a broken market. That is a system that is not working. Why is this system and the challenges here so hard to fix? Why is that the best way to deliver healthcare to people?
Well, healthcare, first of all, is expensive and it's getting more expensive. We have incredible scientific breakthroughs with blockbuster drugs on cancer, on obesity. We have older population, baby boomers like me, who are using more of the health system. So healthcare is getting more expensive. But the fact that this is a sort of shared partnership with employers and individuals and the government playing a role, again, is not unusual. In many countries, Garrett, the government pays for 100% of someone's health care.
Sure.
That's a typical system. We have more of a private pay combined with government. So I would not indicate that it's a broken system. It is a system that has a public-private partnership.
Well, until a few days ago, you really could have said there are only two frameworks for this. There was the system that we have now, and there was a single-payer government system. The president has recently offered what I guess you could consider a third framework, where he talks about the idea of giving people money directly. He's not really clear whether that's to buy insurance or to buy healthcare directly from their doctor. What do you make of that proposal, such as it is, and whether it's sort of a serious, whether it represents a serious alternative way of thinking about healthcare delivery in this country?
Well, it may not come as a shock to you, but I am appalled to have a president of the United States who has been running for this office since 2015. 10 years later, he still has no healthcare plan. He still has no framework for healthcare. I tried to repeal the Affordable Care Act over and over again, now is trying to take big chunks out of it. I think the notion that you give people some money and have them shop on their own he clearly does not understand the insurance market. The insurance market is based on having a pool of people, some of whom are sicker than others, some of whom, use healthcare more. People would be fine if they're 19 years old and healthy and have no drugs that they take. If you're older or sicker or recovering from cancer, that system of giving you some money and having you shop on your own, you would be priced out or locked out overnight.
Well, I don't think that's going to get a bunch of people rushing out to sign up.